Good afternoon and welcome. I'm going to call the Assembly Health Committee hearing of Tuesday, April 14th to order. A couple of quick announcements and then we'll have our first presentation. We will hear, as far as time limits for today, we will hear 2 witnesses per side with a time limit of 3 minutes each. And then additional witnesses, please state only your name and organization for the record and your position on the measure that you're here to testify about. On the consent calendar today, we have the following bills proposed for consent. Item number 3, Bill AB 143, Assemblymember Wood. And item number 18, Bill AB 1130, Assemblymember Gray. And we have a special order of business set for 2 o'clock to hear item 14, AB 775, Assemblymembers Chu and Burke. And we have with us Madam Speaker Atkins for AB 226. We're ready for you whenever you are, Madam Speaker. And AB 635.
Thank you, Mr. Chairman.
Thank you. Sorry. There you go.
Test. Okay. Thank you very much, Mr. Chairman, Vice Chairman, members. I'm pleased to be here today, and I will start with AB 226. Pleased to present that, which will create a new type of non-permanent food facility, a fisherman's market, that will allow California's fishing industry to do what farmers can do now, sell directly to the public, subject to specific regulations. AB 226 only applies to licensed commercial fishermen, registered aquaculturists of California seafood producers selling raw or fresh fish or edible aquatic plants or fresh frozen fish. Last August, the County of San Diego, as part of its Live Well San Diego initiative, permitted the direct selling of locally caught fish by members of the San Diego fishing fleet. Just as farm to table has become a popular way for the public to enjoy healthier eating habits, this Pacific to Plate program in San Diego has been quite popular, with over half a ton of fresh fish sold Saturday mornings since August. However, under current law, each fisherman was required to get an individual permit, and since current law is silent on direct sales of fresh seafood by licensed fishermen to the public, local health departments don't have all the same protections available that they do, for example, with farmers markets. So the solution through AB 226 would establish food safety and sanitation requirements on fishermen's markets and define what takes place in such settings. It would allow one commercially licensed fisherman to hold the permit and be the responsible party in working with local public health agencies. The bill also allows the fishermen to be cleaned, the fish to be cleaned, or in technical terms, eviscerated, a chore which most of us would prefer somebody else do professionally with the appropriate type of knife. And certainly I'm more apt to buy something if I don't have to clean it. County Supervisor Greg Cox in our area convened a stakeholders group that included local fishermen, aquaculturists, the Port of San Diego, the National Marine Fisheries Service, the Maritime Alliance, the University of California San Diego Scripps Institution of Oceanography, and the local health department. So AB 226 is a result of that collaboration in an effort to try to do this and support the fishing industry, but also healthy food. And I would just add, before I turn it over to a couple of the speakers that are here, and back to you, Mr. Chairman, we do accept the technical amendments that your staff have worked so hard on and appreciate the work that you and staff have done to get us here today. So there are a few people here to testify in support of AB 226.
Not yet. Thank you, Madam Speaker. And just to clarify, we are in a subcommittee right now.
Yes.
We don't have a quorum yet, so the committee can't entertain a motion yet. As soon as we get a quorum, we'll establish it and we'll entertain a motion then.
Thank you.
Thank you, Madam Speaker.
Jonathan Clay, on behalf of the County of San Diego and the Port of San Diego, pleased to be here as co-sponsors and working with Speaker Atkins on this important measure. As the Speaker identified, the County of San Diego, through its Live Well San Diego program, and the Port had come together to try and facilitate and make this open-air seafood market happen. We started this in August of last year. It's been a huge success, as the Speaker had mentioned. As we started going through this process, I understood what the permitting hurdles were and the regulations. The county, along with the numerous stakeholders, the Port decided to try and convene stakeholders to figure out how we can make this a better process, both in terms of facilitating the permit, but also still ensuring the protection of public health and safety. So what you see embodied in AB 226 is an outgrowth of those stakeholder meetings. We've also been working with California Department of Fish and Wildlife, California Department of Public Health, other entities to try and make sure that we're addressing all the concerns from a statewide perspective. But in essence, what we're just trying to do here is create a more easy, understandable way for folks to be able to set up these markets like a farmer's market so that people can enjoy locally caught fish. Thank you.
Mr. Chairman and members, Tony Gonzalez, representing the San Diego Regional Chamber of Commerce. I'd like to thank Madam Speaker for introducing this bill, which is great for business and great for consumers. All of the points I was planning on making have already been made and have been articulated in the analysis. With that, I want to thank everyone for the bill. Thank you.
Thank you, Mr. Chairman and members. Moira Top here on behalf of the City of San Diego, also one of the proud co-sponsors of the bill. I think all has been said about the virtues of the bill. We ask for your aye vote.
Mr. Chair, Josh Malone for the local environmental health directors. We're those pesky health inspectors that come make sure everything's safe. And this has been extraordinary collaboration. The Speaker's bill has adopted all the proposed amendments that we've asked for. We're sure it's going to be safe and it's going to be sustainable. So congratulations on a well-achieved bill, and we urge aye vote.
Additional witnesses in support? Any witnesses in opposition? Seeing none, any questions or comments from members? Mr. Mainshine.
Thank you very much, Madam Speaker, for bringing this. This is something certainly, and obviously proud to be a part of it, but something that's going to benefit the businesses in San Diego, the City of San Diego, County of San Diego, but really more importantly, even the residents, who there's really this need there. And we've had a number of people approach us, from back home, asking for this, and so I really want to thank you for all the collaborative work you did on this to bring everybody together, to get all these people in support of this. Definitely a great collaboration, and no matter how far you and I travel, we get to continue to vote on City of San Diego issues, no matter where. It's a curse somehow or a benefit, I don't know which one, but certainly proud to help support this today, and want to thank all the people who came together to make this happen. And as soon as we get a quorum, I'd be happy to move the item, Mr. Chairman.
Thank you, Assemblymember Mainshine. Any other questions or comments from members? Madam Speaker, would you like to close?
Thank you, Mr. Chairman. And let me just do two things. Let me thank the co-authors of this bill, which actually include Mr. Mainshine, Mr. Chavez, Mr. Jones, Ms. Waldron, and Dr. Weber. But this is by no means just a San Diego bill. This is something that will benefit the entire state. I know that for some it may be a little confusing. For example, in the beautiful city of San Francisco and the pier, you see a lot of fresh fish being sold, but they're attached to restaurants who have permits. So just to educate, as I ask for your support, this will benefit not just San Diego, but I'm really thrilled that folks in San Diego, as part of the health initiative, have brought this forward, and I would respectfully, when appropriate, hope that the committee members will support this. Thank you.
Thank you, Madam Speaker. This bill, of course, has my very strong aye recommendation. I look forward to voting for it when we have established a quorum. At this time, would you like to present your next bill?
Thank you, Mr.
AB
Chairman
635.
and members. I am also pleased to be able to present Assembly Bill 635, which will require the Department of Health Care Services to seek federal funding to establish a program that will support medical interpreter services to limited English proficient Medi-Cal beneficiaries. Today, more than 40% of Californians speak a language other than English at home. And as you know, when limited English-speaking individuals attempt to access health care, the language barrier can contribute to inadequate patient evaluation, lack of appropriate treatment, unnecessary procedures, and costs. AB 635 will help California maximize resources by accessing federal dollars to support language assistance to meet the increasing demands of our diverse population. The intent of this bill is to ensure that all Medi-Cal beneficiaries have access to appropriate health care. I have a number of people here to testify in support of AB 635, and certainly am prepared to answer questions at any point that you're ready.
Good afternoon, Chair and members. My name is Kimberly Chen. I'm with the California Pan-Ethnic Health Network, CPEN. CPEN is a statewide health advocacy organization dedicated to improving health in communities of color, and we're very happy to be here to support AB 635. California's population is one of the most diverse in the country, and as the speaker noted, there's a diversity of language, and close to half speak a language other than English. This diversity of languages means that many of our limited English proficient Californians often experience barriers in communicating with their physicians, which increases the risk of misdiagnoses and misunderstandings. We know that patients who have language barriers have higher rates of hospitalization, encounter drug complications, and often fail to return to follow-up visits from emergency rooms. All these factors can result in lower quality of care. And currently, Medi-Cal managed care plans are required to provide interpretation and translation services to these LEP enrollees. However, the state does not have a comprehensive delivery or reimbursement system for language assistance services. This bill provides an opportunity for the state to meet the demands of its diverse Medi-Cal population by offering trained interpreters and statewide reimbursement program. A coordinated reimbursement program will enable the state to better monitor and evaluate the effectiveness of interpreter services for its LEP Medi-Cal beneficiaries. And for these reasons, CPEN is in support and urges your aye vote. Thank you.
Thank you. If I might, for a moment, noticing a quorum, may I ask Madam Secretary to please call the roll.
Bonta.
Here.
Mainshine. Here. Bonilla. Burke. Chavez. Here. Chu.
Here.
Gomez. Gonzalez. Hernandez. Lackey. Nazarian. Patterson. Ridley Thomas. Rodriguez. Here. Santiago. Here. Steinnorth. Thurmond. Here. Waldron. Here. Wood.
We have a quorum. Thank you. Please proceed.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, here in strong support of the bill. We all know it can be difficult to communicate with our doctors even when we're speaking in the same language, and so if we don't speak the same language as our doctor, as was noted by CPEN, there can be very dangerous consequences to patients' health. We are leaving federal Medicaid dollars on the table that we could be claiming for valuable interpreter services. We also don't have a process in California for certifying interpreters, and that's also a very important piece of the bill. So we're here in support. Thank you.
Thank you. Additional witnesses in support?
Chair, members, Gary Passmore with the Congress of California Seniors, and we're in strong support of the legislation.
Teresa Anderson on behalf of California Academy of Physician Assistants in support.
Jerry Gonzalez with AARP in support.
Brian Allison on behalf of the American Federation of State, County, and Municipal Employees, also in support.
Sawait Seam on behalf of Health Access California in support.
Doug Chiappetta with the Union of American Physicians and Dentists with AFSCME, also in strong support.
Thank you. Are there any witnesses in opposition? Seeing none, any questions from members? We have a motion and a second. Assemblymember Waldron.
Thank you, Mr. Chair. I just wanted to make a comment. I want to thank you so much for bringing this forward. My brother, as you know, is a physician in New York who takes Medicaid, and he is bilingual, just happens to be. And on several occasions, he had indicated to me how a patient had come in, some from overseas, couldn't speak the language, and he's able to interpret a patient who was going to be taken in for treatment for lymphoma. He found out they actually had a parasite. So he could have died if he was not able to speak in the language. So it's really critical that we try to get the best care to people when they come in and in Medi-Cal. So thank you.
Thank you.
Thank you. Any additional questions from members? Madam Speaker, would you like to close?
I would respectfully ask for an aye vote. Thank you.
We have a motion. We have a second. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Bonta.
Aye.
Bonta, aye. Mainshine. Aye. Mainshine, aye. Bonilla. Bonilla, aye. Burke. Burke, aye. Chavez.
Aye.
Chavez, aye. Chu.
Aye.
Chu, aye. Gomez. Gonzalez. Hernandez. Lackey. Nazarian. Patterson. Ridley Thomas. Rodriguez. Rodriguez, I. Santiago. Santiago, I. Steinnorth. Thurmond. Thurmond, I. Waldron. Waldron, I. Wood.
Congratulations, Madam Speaker. Your bill is out. We will also go back to Assembly Bill 226, Madam Speaker's bill, and the committee can entertain a motion now that we have a quorum.
Second.
We have a motion and a second. Madam Secretary, please call the roll. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Fonta.
Aye.
Fonta, I. Mainshine. Mainshine, I. Bonilla. Bonilla, I. Burke. Burke, I. Chavez.
Aye.
Chavez, I. Chu.
Aye.
Chu, I. Gomez. Gomez, I. Gonzalez. Hernandez. Lackey. Nazarian. Patterson. Ridley Thomas. Rodriguez. Rodriguez, I. Santiago. Santiago, I. Steinnorth. Thurmond. Thurmond, I. Waldron. Waldron, I. Wood. Yes.
The bill passes 11-0. Thank you, Madam Speaker.